Good evening. Thanks for joining us. We're happy that you're interested in such an important topic, the topic of safe sleep. We're coming from the Kaleidoscope Gift Shop and Safety Store in the University of Iowa Stead Family Children's Hospital. I'm Pam Hugerwerf. I direct the Injury Prevention and Community Outreach Program here at the Children's Hospital. Alongside me is a colleague, Penny Smith. Penny is a nurse. She's a nurse clinician specialist. She's been a NICU nurse for 31 plus years. She also works as a neonatal nurse consultant for Iowa statewide perinatal care program. She's a member of our UI Safe Sleep Task Force, along with several other great experts. She frequently travels around the state to talk to physicians and nurses on and educates them on SIDS and safe sleep guidelines. We're so pleased that Penny was able to take time to join us tonight and offer her expertise and certainly answer any questions that our audience has. Penny, welcome. I thought we'd start by maybe you being able to explain and define SIDS and sudden unexplained infant death to us.
Yes, that's a great idea. So when we talk about sleep-related infant death, the first term we're going to bring up is sudden unexpected infant death. That's SUID. That's the umbrella term for all sudden infant death that doesn't have an explanation, at least prior to any sort of investigation. So there are a lot of different possible causes for SUID. That could include a cardiac anomaly that wasn't diagnosed at birth, or infection, or poisoning, or SIDS. SIDS is one of those possible causes that lives underneath the umbrella term of SUID. So SIDS is sudden infant death syndrome. So that's the death of a baby that's less than 1 year of age that is not explained. And several things have to happen before the medical examiners will use the term or classify the death as a SIDS death. There has to be a death scene investigation. So the medical examiners are trained to go into the homes and the daycare centers where the death occurs and interview the families, the parents, the child care provider, whoever was there at the time of death. They take a doll with them. They do a doll reenactment to see just how the baby was found. So the death scene investigation has to happen, and an autopsy. There has to be a full autopsy, and that includes x-rays, a full set of skeletal series of x-rays of all the bones to make sure there are no fractures. That autopsy will also include a toxicology screen, just to make sure that the baby wasn't exposed to some substance that maybe could cause the baby to stop breathing. And then the third thing that has to happen in order for it to be determined as a SIDS death is a review of the baby's medical history and the clinical history for mom and baby. Sometimes when we see these cases and we review them after the fact, we see that baby had been in to see the pediatrician a couple days before, or he'd been into the ER the night before, and he was sick. He had RSV or a respiratory infection or something that maybe looking back could be a clue as to why this baby would stop breathing. But when all three of those things are complete, the death scene investigation, the autopsy, and the clinical history review, if we can't figure out why this baby died, then it is determined to be a SIDS death. Now, along with the classification of SIDS, we have to talk about one other term that the medical examiners are using more frequently in the last 5 to 10 years, and that's accidental suffocation and strangulation in bed. So the term is ASSB, and they will give this classification if there's a reason in the baby's sleep surface, if there's a blanket that was wrapped around the baby's head, if he started to roll around, or he rolled into an animal, a stuffed animal that was sitting there, or bumper pads or something else that was in his crib, and they're pretty sure that the baby suffocated. If the baby was sleeping with an adult or another child and it was clear that someone rolled over on the baby, and it's an overlying death, that would be a death that's attributed to accidental suffocation. If you fell asleep in the chair with the baby, recliners are a very dangerous place to sleep with the baby, sofa and recliners, because what happens is the kiddo may start sleeping up here on your chest. If you fall asleep, baby slips down underneath your arm and gets trapped between the arm of the chair and between your body. And I've seen several deaths like that over the years. With my work in the perinatal program, I've been able to join Iowa's Child Death Review Team, And that team is a team of experts in Des Moines. They look at all of the infant deaths, all of the pediatric deaths from birth to 18 years of age. And we know that the biggest subgroup of those pediatric deaths are actually the sleep-related infant deaths. It's a huge group of kids. In our state, the incidence is about 1 per 1,000 live births. We have 40,000 live births in Iowa. The math's pretty easy. So it's about 40 kids a year.
Just in our state of Iowa.
Just in our state of Iowa. 40 to 45 babies a year die of sleep-related infant death. Now, Iowa's Child Death Review Team, they publish fantastic data. Every year a report goes out to the governor about what's happened with pediatric deaths, and those are great reports that are available to the public if you're interested to know. But we know where the risk factors are.
Absolutely.
We know what they are. I can tell you what the top 3 are. I've spoken to the medical examiners and to the people that sit on this committee. It's crap in the crib, and that's blankets, that's toys, that's anything loose in the crib that could cause suffocation or cause the baby to rebreathe carbon dioxide if he rolls into it. The number 2 risk factor, and it kind of goes back and forth, 1 and 2. Number 2 is bed sharing, and that's sleeping with your baby. Baby in an adult sleep surface where there's pillows and comforters and blankets and other people that can roll over onto the baby. Commonly, very common, do we see that in our cases in Iowa. The third one we see more commonly in recent years is the wrong position, and that's baby not sleeping on his back, which is what is recommended, back only, but baby was maybe put down on his side to sleep and then rolled prone. The side is not considered to be a safe sleep position for babies because it's unstable. And what happens is the babies roll prone, and then they rebreathe carbon dioxide, and then have a higher risk of SIDS. So that's it. Crap in the crib. Nothing in your cribs. No bed sharing. He needs to sleep in his own separate sleep space, which is a crib or a pack and play or a bassinet. Those are considered to be safe. And nothing in the crib with him. He wears his blanket as a sack, as a sleeper, but nothing loose in the crib.
That's a great introduction, Penny, and I think it gave our audience, the important facts that we need to know. If you're just joining us, we are answering your questions. I'm going to begin to answer your questions on safe sleep. So certainly, as they come in, they'll be shared with us, and we'll do the best we can answering them.
How do you safely swaddle your baby for sleep?
So, as Penny mentioned, we no longer certainly suggest that you use any type of a loose blanket like maybe they did several years ago. So instead, there are products out now that take the place of the loose blanket, and Penny has one, and I'll let her kind of explain it.
So this is just one product, and Halo makes the sleep sacks and the sleep swaddles, but there are others out there. There's some really cute new products on the market, actually, that are sleep sacks. So it needs to be a wearable blanket. That's the point. So we're going to zip up the baby, and I'll bring our little guy over here, and let's look at him. Very cleverly designed, so the zipper's at the top, so it's going to end at the bottom of the sack under here. So this is his sack. That's what he's going to sleep in. And then the wings of this then become the swaddle. Instead of a loose blanket that could be over his face or rolling around in the crib, it's actually attached to the sack. So we take the short side in first, and the commercial product actually has Velcro, so it will Velcro to itself, and then wrap the other one around this way. So the wings actually, they're going to attach on the back of the sack. He's going to be sleeping only on his back, not on his side, not on his tummy, so this is perfect. The wings can't come up over his face. There's no loose blanket. Babies like to be swaddled for about the first 3 to 4 weeks. After that, certainly after a month, most kids want to get out of that. By then, they want to move around. So you can still use this sleep sack as a wearable blanket during those times. You just raise his arms. So when this kiddo starts to look like he's gonna roll over, if he's starting to push up when you're doing that awake supervised tummy time, you think, boy, he's getting close to rolling over. So, certainly by 2 months of age, we want to stop swaddling them with their arms in. They have to be free. Their hands have to be free to get out of danger if they roll over. So with the sack, we're just going to move his arms up She's going to bring in the short piece. We're going to bring in the long one around the back. And then he's got his arms free. Then that swaddle sack just became another wearable blanket. And it's perfect.
Penny, to go along with that, a lot of our viewers have asked us in the past, and as far as what else should go on the baby underneath the swaddle. So they're worried about the temperature. Is the baby going to get too hot? What's the temperature in the room, the suggested temperature in the room, and that.
And that's valid because overheating is a big risk factor for SIDS. It has been for a long time. So what we want to do, there's kind of a general guideline for dressing your infant for the environment. Whatever the room is, whatever you're comfortable in, add one more layer. So if you're comfortable in a long sleeve shirt in that room, you're going to add one more layer to the baby, probably a onesie underneath his sleeper, his long sleeve sleeper or whatever you have on him. But one more layer than what an adult would be comfortable in that room.
Right.
If you're looking for a specific room temperature, 68 to 72 degrees. There's something you can kind of pin your hat on, and if you're interested in that reference, I'll have to look that up for you and let you know, but that's just a general guideline.
Sure.
No warmer than 72 degrees in baby's room. And then you want to watch baby. Make sure that you don't see signs that he's hot. If his chest feels hot, or if he's actively sweating, you see the baby sweating, you've got too many layers on your baby. It's time to strip off some of those layers.
Observation is key with all of our injury prevention programs. It's all about observation. Even when a baby's sleeping and very calmly, observation is so important. If you're just joining us, again, we're taking questions about safe sleep. So feel free to submit your questions, and they'll be relayed to us, and we'll get them answered.
Do you recommend sleep monitoring devices such as the Owlet?
That's a great question. We knew that question was going to come up. There are several products on the market right now that are, I guess they're marketed to monitoring your baby, and there's smart technology that sends messages to your smartphone about movement, about breathing, about several different things. And I just have to, at this point in time, we just have to relay what the American Academy of Pediatrics says about home monitors. And their stance at this point is that home monitors are not a strategy to reduce the risk of SIDS. So what we're afraid of is that you're going to use these fancy devices that might be the next best thing. We don't know that yet, and that's the whole point with the AAP. We have to have some solid research to know that these products do what they say they're going to do.
Right.
And at this point, there's not a product, not a home monitor on the market that fits that bill.
Exactly.
There's not enough research. There's not enough experience. Some of what you see on the websites, it's compelling. You see it and you think, gosh, this has got to be the next best thing. This is going to be perfect. But at this point, from November 2016, that was the last time the Safe Sleep Guidelines were written, home monitors are not recommended as a strategy to reduce the risk of SIDS.
Right.
When is it okay for a baby to be on their tummy?
Can I take this
Great
one?
question. I'd love for you to.
That's
And then
a great
we're going to show
question.
them a diagram also
Yes,
after
we
you
are.
do some
We are.
questions.
Back to Sleep started back in 1992. That was the first time that we recognized that we had to start putting our kids on their back. The first statement about SIDS came out from the AAP. 1994, Back to Sleep caught on, and the incidence of SIDS in our country dropped by 50%. It was huge, huge, Back to Sleep. So we recommend back only for sleep. If you're going to put your baby on his tummy, it should only be for awake, supervised tummy time. And that is recommended. That's in the guidelines. We want these babies to be, when they're awake, when you're watching them, using these muscles, developing the shoulders and the arm muscles for strength. I mean, that's all part of normal development. What we don't want is the baby that's put on his tummy intentionally to sleep. Okay? We don't want him on his tummy. We don't want him on his side for sleep because of the risk that he will roll to his tummy, because it has to be one of the biggest risk factors for SIDS. And we still see it. We see it in our cases in Iowa. I've seen it as recently as a month ago, a baby that was put down on his side in a case review. On his side, he was a spitty kid. They thought he was going to throw up, so they laid him on his side, and the baby rolled prone.
Sure.
And that's how they found him. They found him on his tummy. He wasn't breathing, and he died.
So back to your back to sleep that was introduced in
Yes.
1992. I know, when my oldest is 30, and when I had her, it was you put them down on their stomach, and now there's that back to sleep came, and I think that I love this diagram. I think it does a great job of explaining
Right.
why it's important. So would you mind kind of walking us through what this is? Yeah.
Perfect. I mean, this is about anatomy. This is the kiddo who's laying on his back and the position of his trachea and his esophagus. If he's on his back over here, the trachea is on top. So the esophagus is on the bottom. So gravity is your friend with that. So if he spits up, it's not likely going to come up and into his airway. Whereas if he's laying on his tummy and you just reversed everything, now suddenly the esophagus is at the top. And if he spits up, the likelihood that those secretions or that vomitus, whatever it is, can end up in his airway is more likely with him on his tummy versus sleeping on his back. It's anatomy.
Yeah.
It's anatomy.
Absolutely. If you're just joining us, we are taking questions on safe sleep, so feel free to submit the questions and we'll get to them as we can.
This person has an 8-month-old baby who just started to wake up in the morning on his belly, and he has a sleep sack. Should they continue using the sleep sack or a different?
Great question.
We think you should continue using the sleep sack. The sacks, and that's without the wings. I would have to assume that that's just a sack.
Mhm.
Remember, the sack is just, we probably should have pulled out a sack here, but if you can imagine this guy without the wings attached to it, that's a sack. And that's perfect. That's recommended up to 1 year of age. And you should know that, now is this a boy? Little guy?
Yes.
He really is at a low risk of SIDS. By the time you reach 8 months, very low risk of SIDS by then. That 90% of SIDS happens in the first 6 months of life. And the incidence of SIDS peaks around 1 to 4 months. That's the time that we're really concerned about these things. But the fact that your guy is rolling around now, he can roll around in the sack as long as there's no loose blankets or anything up in his sleep surface that he's going to get tangled up into that could cause him to suffocate. Or bumper pads. Hopefully you don't have bumper pads in your crib, because what happens is these guys start to roll around, they end up face into whatever you've got there. I have a beautiful picture that I use for education purposes. Beautiful open crib all down here, and then in one little corner they have stuffed toys and a pillow and a bunch of crap that doesn't belong there. Where do you think that little girl started to roll? She rolled straight for the crap. And they have a picture of her face down. This baby was alive. They thought it was cute, I think. But they took a picture of her with all of her stuff in the corner. Beautiful empty crib over here where she was safe. But she rolled right to the crap.
Sure.
Stuff that should not have been in the crib. So,
To go along with that question about the 8th month, another topic that comes up a lot is if you find your 4-month-old on their
Right.
tummy, because now they're able to roll over,
Right.
should you actually, physically go and
Flip
turn
them
them back
over.
on the back?
and no, and I can tell you that that's not, you don't have to do that. And the AAP is pretty clear about that. Once they start to roll around and you don't have anything loose in their crib, there's nothing that really poses a suffocation problem, once they're able to roll around, they can get out of danger. If they end up on their tummy, they're developing these muscles, they can push up, they can move. You don't have to keep flipping them over. When you put them down to sleep, certainly start them on their back, because that's the safe position. But if you go in 2 hours later and he's laying on his tummy and he's asleep, you don't have to flip him back over.
Great.
Okay, good to know.
At what age is it okay to give your child a blanket or pillow in the crib?
You don't need a pillow. And I'm going to speak, I'm a neonatal expert, so, and maybe an expert on infants up to 1 year of age. That's what the safe sleep guidelines are designed for. No pillows up to 1 year of age. There's no reason for them. Once they become toddlers and they get into a toddler bed, and then it's more like a big kid bed, then you can think about pillows. I would not use loose blankets until after their first birthday. That's the recommendation. A wearable blanket, a sleeper. It doesn't have to be a sack. It can be a sleeper. Just a sleeper, if it's winter, it can be a fleece sleeper. If it's summer, just a cotton sleeper. Something they're wearing on their body and not a loose blanket.
What's your opinion on babies sleeping in a rock and play?
The rock in place. So that's a Fisher-Price
Yes.
product that came out a few years ago, and there are so many things wrong with that thing. I'm going to try to be very politically correct and diplomatic here, but the thing is, babies are safer flat on their back than they are semi-reclined, especially young babies, especially babies that are 4 months or younger, because these muscles, the neck muscles, are not well developed. They have a big head on muscles that relative to the rest of their body, on muscles here that aren't very developed. So the way you find them many times in a sitting device is with their head off to the side or falling down like this, or in some way that could obstruct the airway.
Right.
So that's why we don't like the semi-reclined. Car seats, that's not a good place for your baby to sleep, and we can talk about that in a little bit. One of the reasons I don't like the rock and play. The other reason is it's a fluffy environment. If you've seen this thing, it's filled with all sorts of padding and soft. So not only is it semi-reclined, but it's soft and fluffy.
Right.
These babies, they can slide into a position when they're semi-reclined that just compromises their breathing. So don't let them sleep in the rock and play. If you want to use it for a wake time, when you're interacting with your baby and it's fun to swing and maybe soothing if they're really irritated and crying, use it that way. But when they fall asleep, please take them out of the rock and play and put them flat.
Sure. And to expand on going back to the car seat, because that's always a concern, because oftentimes just the movement in the car lulls a baby to sleep. And so there's the concern about, should I allow that to happen? And then to add on to that, if they get to their destination and they're asleep and you bring them in the seat, can you allow them to continue to sleep in the seat until they awake?
That's a great question, and it's a huge quandary for parents, especially sleep-deprived parents who maybe have a fussy baby and they think, he's sleeping, I'm not going to wake him up for anything. The reality is you need to take him out of the seat. And I can tell you of at least 3 cases in Iowa that I've reviewed after the fact when the baby died in his car seat. The one most recently, that was his routine place to sleep, was in his car seat next to the mom's bed. For the reasons that I just explained about semi-recline versus flat. He shouldn't sleep in that car seat if he's not observed. In other words, if you're going to put him off over here, if you're looking at him and he's sleeping in his seat, maybe that's okay. If he's being observed and being supervised the whole time. But if you're going to just set him off over here and let him sleep, that's not a safe place. I tell people all the time, better to take him out of that seat at grandma's house, even if she doesn't have a crib, put him flat on the floor. Flat on the floor. That's safer than sleeping in his car seat.
Now what about when they're in the vehicle and they fall asleep? What's your
Hopefully
recommendation?
they're being supervised in the vehicle. For younger babies, especially low birth weight babies, we take care of a lot of premature babies here that go home when they're small. So we're discharging babies that are small for the seat, seats that are designed for full-term kids that we're putting premature babies in. And for all of that next stuff we just talked about, their risk is even higher.
Sure.
I would recommend, if you've got a small baby, a low birth weight baby, that first month, first few weeks, ride in back with your baby. Mom, ride in back so you're watching baby, just to make sure that she doesn't end up in a position that compromises breathing.
If you're just joining us, we are taking questions about safe sleep, and we have a few minutes left, and so certainly feel free to submit questions, and we'll get to them as we can.
All right. Somebody has 10-month-old twins who get their legs stuck in between the bars of the crib up to their hips.
Okay.
Is there anything to prevent this or help? They did see their mesh breathable bumper pads.
Yeah, the mesh, that's another product out there that just has no research that the American Academy of Pediatrics is going to recognize at this point. Their stance on bumper pads is no bumper pads. I used bumper pads for my kids when they were little back in the 90s. We thought we were preventing injury with the bumper pads, when really we weren't preventing injury at all. We have new crib standards now. Back in the day, the slats were this wide, big enough for an infant head to slip through. That's how bumper pads started. We didn't want his head slipping through the slats. In 2011, all of the crib standards changed. Everything changed for cribs, and they were narrow. They're narrow now. He might be able to get an arm or a leg through, but it's not going to cause injury. And the risk of death versus getting a leg out, you know what I mean, versus suffocation for something that he might roll into, We just need to not use the bumper pants.
All right. This person has a crib her kids used when they were newborns. Can she use it for grandchildren?
That depends. That depends on how old the crib is. If I were you, I would go online to the Consumer Product Safety Commission and look at those the specifications for cribs that
Right.
are the rules and regulations that we have today. Many of the old cribs, I took my cribs to the dump.
Right.
Because you can't sell them.
Mhm.
You can't resell the drop side cribs. You can't sell them anymore. Just look very carefully at your crib and just make sure that it meets the safety standards, that the hardware on the crib is not in disrepair. Sometimes we get cribs that fall apart and babies get caught.
And also paint, you have to kind of be concerned about the lead. Is there lead in the paint that's on the crib?
How
So
old
the
is the
Consumer
crib?
Product Safety Commission is a great resource
Yeah,
to have
it's a
that
great resource.
question answered.
Is it okay if a baby sleeps while they are in a sling?
Sling, that is a great
Yeah.
question. And I think it was 2010. The Consumer Product Safety Commission put out an advisory, a safety advisory about this because there were several deaths in our country. Babies that actually were being worn on a sling on mom's body. Baby had slipped underneath the sling so his face wasn't visible and baby stopped breathing. You know, mom's busy, she's doing 15 other things while she's wearing her baby, which is great. I mean, it's great that moms can do that, but you have to be careful. And the guidelines for that, the AAP is specific about this as well. It's great that you wear them on a sling, but just make sure that their face is visible. Their nose and their mouth is up above the edge where the sling is holding them in. So you can see that they're breathing,
Right,
that their
exactly.
airway is clear. If you want to breastfeed in the sling, that's great. You can breastfeed down here, but then as soon as they're done feeding, bring them back up so that you can see their face.
Right. Right. I think I'd like you to, just because it's we've got about a minute left, to talk about the breastfeeding and the benefit of that and the relationship to the reduction of SIDS cases. And I think that's probably our last opportunity to say anything tonight, but we certainly will be happy to answer questions still. We'll follow through, so go ahead and keep submitting them, and we will get back to you with answers. We really appreciate that you were part of our session tonight, and we thank you again for tuning in. So Penny, if you want to just kind of end this with the breastfeeding.
I will. And in fact, I
message.
may even add the other things that have been found. There are several things that are protective of SIDS. So pacifiers, for one. Pacifiers are protective. The mechanism is not fully understood yet. It's something about the sucking. That sucking, just if they accept the pacifier and start to suck on it, even if he spits it out once he falls asleep, the protection lasts the entire sleep cycle. So after their breastfeeding is well established, around 3 to 4 weeks, we don't want to give them a pacifier in the very beginning at birth because of breastfeeding. We want to make sure that it's well established. But once they're 3 to 4 weeks old, and start offering that pacifier every time they go to sleep, if they take it, that can be protective.
Sure.
Don't attach the pacifier to his clothing or anything else, no toy, just the pacifier, loose in his crib. Other things that are protective, immunizations are found to be protective. Prenatal care, moms should be getting prenatal care, and breastfeeding. Finally, breastfeeding, a fantastic paper was just published just a few months ago, late 2017, about breastfeeding and reducing the risk of SIDS. And what they found in this was that if you breastfeed for at least 2 months, and that's any breastfeeding, that's not just exclusive breastfeeding. We used to think that it had to be exclusive in order to convey
Sure.
that protection for
Right.
SIDS. It doesn't have to be exclusive. That's any breast milk, and maybe even breast milk that's just fed by a bottle. Some moms choose to pump and feed
Yeah.
a bottle. It's the milk. It's not the nursing that's protective. It's the milk for at least 2 months. Reduces the risk of SIDS by 50%.
Yeah,
That's huge.
Yeah, that's
That's
amazing.
huge.
Mhm.
And then when you compare babies that feed for at least 2 months and you take it out for 2 to 4 months, the protection is greater. If you take it out to 6 months or greater, it's even more protection. The risk for SID is even lower. So breastfeeding is fantastic. Breastfeed for as long as you can for at least 2 months by 50%.
Great.
That's huge.
That's great, Penny. Thanks again for joining us. Thanks for sharing your expertise. Please continue to submit your questions, and we will get back to you offline.